jump in and share my screen. I'm going to show quite a few diagrams and things like that. And if our photo strip that's on the side of your screen is getting in the way, feel free, please, to minimize that or drag it out of the way or whatever. Hot flashes represent vasodilation. The blood vessels in the skin are suddenly dilating, and it's suddenly 150 degrees, and it's as if somebody just turned on the radiator. But as Dr. Fugh-Berman mentioned, many women don't have these at all. In some cases, they're quite mild. For some women, they're very, very bothersome, and they can occur at night. But in the 1980s, a Canadian researcher named Margaret Locke went to Japan, interviewed more than 1,000 people, and was impressed by the seeming rarity of hot flashes and frankly, menopausal issues at all in Japan. And the first question was, well, are Japanese women just being kind of reticent? And I don't think so. I think their experience of menopause really was that it was not such a big deal. And it was not just in Japan, but also in China. The China study of midlife women, 1992 to 1996, found that hot flashes were pretty uncommon there as well. 13.5% of women were reporting them. And so why would that be? Well, the first suspect was the soybean. The soybeans are used a lot in Asian cuisine, and they have isoflavones. And isoflavones like genistein, daidzein, glycine, do in fact adhere to estrogen receptors. And this is part of why they reduce breast cancer risk. And we'll talk more about that a little bit later, but, or why this is believed to be why soy products will reduce breast cancer risk. But there's some other issues about that that I'll get to in just a minute. So researchers have said, let's test them out. What if I take a soy extract or soy foods? Will that reduce vasomotor symptoms? So this is a 2016 systematic review and meta-analysis published in JAMA. And let me start by looking at dietary isoflavones, the isoflavones in your soy milk. And if you're new to a forest plot, that's the diagram on the right. Every study gets a little black dot. And if something was helpful, then the black dot is to the left of that vertical line. If it's harmful, making things worse, then the dot is to the right of that line. Well, there are 4 studies, and 2 of them are to the left, and 2 of them are to the right. So we're really not getting very far. But then they also looked at supplements where you can concentrate the isoflavones more. There you're seeing a more consistent response, but still quite a lot of variation. And needless to say, a huge concern is the possibility of publication bias. These are commercial products and nobody's forcing people to publish negative findings. So overall, people have not been wildly enthusiastic about these, even though there does seem to be some effect. However, something else came into our radar, and that's that hot flashes were changing. Japan was changing. The rice-based diet, lots of rice, lots of vegetables, not that much meat, of the 1980s gave way to a more Western kind of diet. And by around the 2000s, hot flashes were substantially more common. So what's going on? The first thought was they must have stopped eating tofu. Well, maybe not. In 2006, soy intake was tracked. And as you can see, that's the black dots. It's kind of about the same. People in Japan still like miso soup and tofu. But what did change was how much other food was being consumed, squeezing the soy out, so to speak. So they're still consuming the same amount of soy, but the percentage of its total protein has dropped. Okay. What in the diet is responsible for that? What's coming in a big way? The diet is westernized. So there's more meat, more eggs, more fish, and a whole lot more dairy. Cheesecake was not a Japanese tradition, but it started to become one. And what dropped was rice, other grains, and potatoes. So a more plant-based diet gave way to a more animal-based diet. Now, as Dr. Fugh-Berman mentioned, it's not just Japan. If you fly to Cancun and get in your rental car and drive about 2 hours west, you'll end up in a town called Valladolid. And right next to it is a little town called Chichimila. And researchers interviewed Mayan women, and none of them had hot flashes at all. They didn't say they had much of any big issue with regard to the menopausal transition. So researchers wanted to think, what are they eating? Maybe there's a clue there. Well, they're not eating rice. Their favorite grain is corn. And it's not soybeans, but their favorite bean is the black bean. And lots of vegetables. This one is called la chaya, and there are many others that were traditionally part of the Mayan cuisine. However, needless to say, all that is changing year by year, with chicken wings and Velveeta coming in a bigger way everywhere in the world, and I'm sorry to say, including rural Mexico. Now, the Women's Health Initiative brought us some really interesting data, looking at could diet changes somehow actually play some kind of role in vasomotor symptoms. And they had a huge number of people, 17,000 women, and more than that. They're reporting their vasomotor data. And they're 50 to 79, nobody's on hormones. And the intervention diet that was tested was not a vegetarian diet, but on the other hand, it was reducing fat, and it was increasing fruits and vegetables and whole grains. That's the intervention. What happened? Well, if you look at the odds of being free of hot flashes within the next year, if you lost 10% of your body weight, your odds of being free of hot flashes were increased by 23%. Okay, weight loss seems to be helpful according to this study. And whether you lost weight or not, if you follow the dietary intervention, reduce fat, increase vegetables, fruits, whole grains, there you're going to see about a 14% increase in your odds of being free of hot flashes. So their conclusion was that the dietary intervention seemed to ameliorate symptoms over and above the effect of the weight change. Okay. Meanwhile, researchers started looking at people following vegan diets. This is Bonnie Biesold's work in Illinois, and it's just a cross-sectional study. But she noticed that omnivores had more vasomotor symptoms than vegans, more physical symptoms, and this was in the perimenopausal period. On the right-hand side, you see her data of postmenopausal women. There, the difference between the groups is rather modest. But we would want to take that with a grain of salt, because this subject population included women who were up to about age 80, at which point both groups would be probably about equal with regard to vasomotor symptoms, but it doesn't really tell you what was happening when they were in their 50s. Okay, so the plot's going to thicken. We've talked about soybeans. We've talked about the overall diet. We've talked about weight loss, and maybe people on plant-based diets do better, but the diet affects the gut microbiome, your gut bacteria. And the microbiome affects your isoflavones. Okay, let's walk through this. Daidzein is an isoflavone. If you eat soybeans or any soy product, the daidzein is in your gut. The bacteria are in your gut, and they discover the daidzein has arrived, and they metabolize it into another compound called equal. Equal goes into the bloodstream, and it seems to have a hot flash, anti-hot flash effect too, that is more powerful than daidzein and perhaps more prolonged. All right, the question is, if I consume soybeans and the daidzein comes out and it's in my gut, will my gut bacteria be able to convert the daidzein to this equal, which seems to be more effective against hot flashes? Well, Ken Setchell in Pittsburgh wrote about this. Western adults tend not to produce equal. Maybe 20 or 30% do. Again, you can eat soybeans all day long. You're not making it. It's your gut bacteria that make it from the soybeans. Asian adults, traditionally, 50 to 60% were producing equal. All right, so maybe that's why soybeans work better for them. I don't know. Researchers in Australia did a similar comparison, but in this case, they compared non-vegetarians to vegetarians. Non-vegetarians tend not to produce equal, 25% did. 59% produced equal, and in the United States, similar findings. Small studies, but the people following plant-based diets seemed to do better. Okay, so here's a hypothesis. What if I wanted to treat hot flashes? If I used soybeans, that would provide the isoflavones that seem to have at least a modest effect. But what if I eliminate animal products and I minimize oils? That's going to help me lose weight. But that will also change my gut microbiome. Prior researchers, including those by our team, but among others too, have shown that when people get away from fatty foods and animal products and greatly increase fiber and plant foods in general, the gut microbiome changes, and you can identify changes as soon as 2 to 3 weeks. Okay, so I'm going to have soybeans, plant-based diet, and see if my gut microbiome is going to cooperate, and maybe that's going to work. Well, let me tell you a slightly funny story. In 2020, I wrote a book that was about hormones in general, insulin, thyroid hormone, testosterone, and estrogens, and how foods seem to influence these things. The book was called Your Body in Balance. And I described the effect of isoflavones and so forth as rather modest on menopausal symptoms, but I encourage people to give it a try. A reader called me up and said, I did what you said in the book. My hot flashes were gone within 5 days. And I thought, wait a minute, I never promised anything like that rapidity. Tell me, her name is Betty. I said, Betty, tell me exactly how you interpreted what I had written, because it was basically what I've told you now. She said, well, I was totally vegan, no animal products, extremely low on fat. I fried things in broth or wine or water, but didn't use any oils at all. And I used whole soybeans, Laura brand non-GMO soybeans I bought on Amazon. I got an Instant Pot, I cooked them up, and I had a half a cup of whole soybeans every day. When she told me that, a light bulb went off in my head. Because if you are at a Japanese restaurant and they give you the little bowl of edamame, those are immature soybeans. They have a modest amount of isoflavones. If you leave them on the vine and they grow longer, the isoflavones develop. She was using whole mature soybeans, much more powerful isoflavones. Okay, all right. So I thought, all right, I'm intrigued by her experience, but that's just one person. I wanted to see if in a randomized clinical trial, we could quantify what the effect would actually be if you did this in an objective fashion. So we brought in a group of postmenopausal women. They all had at least 2 moderate to severe hot flashes per day, and half of them did Betty's diet. The other half did not. The diet intervention was no animal products, minimize oils, half a cup of soybeans every day. And the diet was fruits, grains, vegetables, and legumes. And we asked everyone to take a vitamin B12 every day, which you need if you're on a vegan diet. Because we started the study in September, last September, and the pandemic was in full swing. And so we used electronics to help us out. Everyone used an app called My Luna that's on your phone, and it's the easiest way to track hot flashes. If anybody's doing this, don't use a journal or something like that. You're not going to have the journal with you when you're out to eat or at the movies, but you know you got your phone. So you just push the little button and you can track the frequency and test intensity, duration. You can track whether it occurred at daytime or nighttime. Everyone got a self-calibrating digital scale from Renfo that we sent them, and everybody got an Instant Pot if they didn't already have a pressure cooker to cook up their soybeans. And then we tracked other symptoms using electronic questionnaires. The participants were in their mid-50s. Mostly, the sample was mostly white, but not entirely. BMI, a little bit into the overweight range. Many women were normal or healthy weight, and some were more severely overweight. And they'd been out of menopause, all of them for more than a year, but some a little bit longer than that. Okay, when it came to weight loss, remember, weight loss seemed to help in the Women's Health Initiative. The control group gained a little bit of weight, which happens between September and December for people overall. They gained less than a kilogram, but they didn't lose. The people in the diet group lost not quite 8 pounds. All right, how about hot flashes? When we looked at hot flashes, both groups actually did somewhat better, but hot flashes of any severity dropped from about 6 a day to about 1 a day in the intervention group, and from about 5 to about 2.5 in the control group. But then we looked not just at any hot flash, look at the ones that are bothersome, the moderate to severe hot flashes. And there we saw something really quite interesting. The intervention group started out at about about 5 hot flashes per day, and that dropped to less than 1 per day by 12 weeks. And when we looked at how many women had any hot flashes, by the way, that was a drop of 84%. So the women noticed it and very much appreciated it. At the beginning of the study, all the women in the intervention group had moderate to severe hot flashes. By week 12, 59% of them had no more moderate to severe hot flashes at all. They might have said, I had a mild one today, I was in the garden and I started to feel warm and I wasn't sure if it was a hot flash or not. But for 59%, the moderate to severe ones were just gone. With the control group, we did not see any change in that variable at all. We also tracked, using an electronic questionnaire called the MENQUAL, changes in vasomotor symptoms, which improved in both groups, but much more strikingly in the diet group. Psychosocial symptoms, physical symptoms, and sexual symptoms, to my surprise, were also reported greatly improved in the intervention group compared to the control group. So by now you might be thinking, what about that control group? They didn't do great, but they did better. And the short answer is, I don't know why that is. And in research, it's better to not guess, but I can come up with some hypotheses that we might investigate. One possibility is that menopausal symptoms change. They change over time, and they tend to diminish as the years go by. So it's possible that between September and December, some women got better just naturally. The other thing is, it was getting noticeably cooler, and maybe that was beneficial. The other thing was, we asked the control group not to make any diet changes. However, to keep them the same as the intervention group, we gave everybody an Instant Pot. And we also gave them a scale, so they knew every day how much they weighed. And they also had volunteered for a study that was going to test a vegan diet, and they clearly preferred to be in that group. And so I cannot rule out the fact that they might have started making some changes on their own, but the bottom line is we really don't know why they had some improvement in the control group. Okay, let me come back to what I hinted at earlier. When you talk to people about soy products for any use, they will very often say, I heard that soy products are linked to breast cancer. In 2008, a meta-analysis looked at that association, and combining the results of 8 studies in Asians and Asian Americans, which is the group you really want to study because you see this very wide variation from low to high soy intake. A high soy intake was associated with a 29% reduction in the risk of breast cancer. And then if you look at women who have had breast cancer in the past, and they've been diagnosed and treated, and they've got one thing on their mind, which is I don't want that to return, the risk of dying of breast cancer has been examined in those people avoiding soy and those having a lot. Combining 5 cohort studies of over 11,000 participants, all of whom had had breast cancer in the past. The red bar here is women who had very low soy intake. They did the worst, they had the highest mortality. The yellow bar is women who had had an estrogen receptor negative cancer. Those who had, in green, had an estrogen receptor positive cancer. And in both cases, you see maybe what call it a 25 or 30% reduction in the likelihood of dying of their cancer. So there are 2 things that are noteworthy here. One is that soy products are not associated with higher cancer mortality. They're associated with a clearly lower cancer mortality. So the well-meaning but ill-informed oncologist who says, I wouldn't have any tofu if I were you, now that you've been diagnosed with breast cancer, you're sliding that woman into the red bar here, the group that's associated with higher mortality. Now, I think it's always good to have more research on this, but we really don't have any good evidence in humans that soy products present a problem, either from the standpoint of cancer incidence or mortality. Probably the opposite. The other peculiar thing is that we see a benefit even in estrogen receptor negative individuals, which raises the question that I hinted at earlier. Does any of this have anything to do with attachment to an estrogen receptor? Maybe it's something completely different. Okay, let me come back to this. What got people nervous decades ago was that isoflavones do attach to estrogen receptors. And they thought that will make men effeminate, that will cause breast cancer, and none of these things occur. But it's important to know that there are 2 broad categories of estrogen receptors. Alpha receptors are particularly prevalent in the breast and the uterus. beta receptors in bone, urogenital system, and the vasculature. The isoflavones preferentially attach to beta. So to put it in kind of a simple-minded way, on the floor of your car, you got a gas pedal, you got a brake. The gas pedal speeds things up, the brake slows things down, and soy isoflavones can be thought of as the brake. Okay, they're not essential, you don't have to have them, we're not pushing them, but they don't seem harmful and they do seem to be beneficial. Let me just finish by how we prescribe this kind of diet in the research studies that we do and here in clinical care at the Barnard Medical Center. We've had thousands and thousands of people begin this kind of diet. We've never seen anyone unable to do this. So let me describe the technique that we use. Person comes in, and we do this particularly with weight loss or diabetes, but we also now do it with menopausal symptoms. You encourage a person to check out the possibilities. They want to go vegan, but they're afraid that that means they'll have to acquire a taste for folk music and wear tie-dyed clothes, so they're nervous about this. You say, just take a week and think about what you would eat if you were avoiding animal products. And so we give them a piece of paper that lists the meals, and you say, fill out this list with foods you might like to eat that don't have animal products. And so they'll think, okay, I could have my oatmeal without cream. I could have it with some sliced bananas or some blueberries or something. And I could have pancakes without the butter. And maybe I could scramble some tofu. I don't know. If they like it, write it down. If you don't, don't. And then for lunch, maybe it's a veggie burger or veggie fajitas or whatever it might be. And you discover that an Italian restaurant has you covered with angel hair pasta and a marinara sauce, or pizza without cheese, okay. A Latin American restaurant will have beans and rice and veggie fajitas and bean burritos, and Chinese rice, Chinese vegetables, tofu dishes, fair enough. Extra points for Japanese, because it's naturally low in fat, and they've got the cucumber rolls and the sweet potato rolls and all kinds of plant-based sushi. Now, Taco Bell is not the pinnacle of culinary art, but if you happen to get the bean burrito there and hold the cheese, I guess that's plant-based. So after a week, your patient comes back and she or he will have a good list of plant-based foods. Now, assignment number 2 is take 3 weeks and dive in and eat those foods. We're going to be completely plant-based, but only for 3 weeks, and use your list. The patient invariably says, that's easy. I can do anything for 3 weeks, and I've already test-driven these foods. I think I can do this. After 3 weeks, oh, and by the way, and meet with them every week, or have them meet with your dietitian, or if you don't have a dietitian, have them meet with ours. They'll work out issues like travel or a reluctant family member, whatever. At the end of 3 weeks, 2 things happen. One is physically they are feeling different. They're losing weight, their hot flashes might have improved if they have diabetes, their blood sugar is improving. But if they have actually gone 3 weeks without a steak or a chicken wing, it's like a smoker not having a cigarette. The spell is kind of broken, and they're thinking about foods in a much more healthful way, and their tastes are really changing. Okay, last thing I'm gonna just mention, how do you prepare soybeans? It's not edamame, those are the baby ones. It's the mature whole soybeans, and you can go online and buy these non-GMO ones, and there's all kinds of brands, including organic soybeans that you can buy. Throw them in your pressure cooker, have a couple of inches of water on top, cook them for 40 minutes. They should not be al dente. They should be soft like a nice pine nut or something like that. Put them on your salad. If you want, you can roast them. To roast them, pressure cook them first. Spread them out on a baking sheet with parchment paper underneath. Bake at 350 for an hour. They come out, make sure they're dry. They should not be squishy or moist. And then season them up with whatever salty, spicy things you want. If they're really dry and you did this right, they've got a shelf life of forever, and you can carry them with you when you travel. So our participants did this when they were traveling during the study. If you don't feel like doing your own, you go online and you can buy roasted soybeans, non-GMO, already made. Now you can do this with soy milk or tofu, but it takes 2 quarts of soy milk to get the isoflavones you get in a half cup of cooked soybeans, which is why Betty's comment rang a bell with me. Let me stop at that point And we've gone through a whole lot of information that I hope has been helpful to you. But let me turn it over to our hosts to toss us some questions, and we'll go from there. We've got maybe 10 minutes left for questions.
Wonderful. Thank you to both of our presenters today. We greatly appreciate the information. There's a lot of it there. I'm going to remind the audience that you can enter your questions into the chat box, and I will have the pleasure of reading them to our presenters to get some answers for you. So to start off our conversation, and while people put in some things in the chat box, I'd like to ask a question to both of our presenters. We'll start with you, Dr. Fugh-Berman, and then we'll go to Dr. Barnard. I think, and to borrow a phrase from the pharmaceutical industry, it's probably the best thing to do when you have a question about health is to ask your doctor. But as you know, we have a lot of information out today in social media and the media and so forth. Can both of you give us some tips on what are some things to keep an eye out for in terms of phrases or wording that would be automatically misleading and should in your mind sit there and go, well, that's probably not the way I should go on this topic, as well as some phrases and some terms that should signal in your brain, okay, so this is actually good advice on menopause. So Dr. Fugh-Berman, I'll start with you.
Well, it's, you know, asking your doctor is good for some things and not good for others. I think Dr. Barnard would agree with me that a lot of physicians really don't know very much about nutrition. And as he mentioned, sometimes have actually given people wrong information about the dangers of soybeans, et cetera. So yeah, a lot of doctors don't know very much about nutrition, unfortunately. But there are many things I mean, unfortunately, just sort of speaking in general, there's a lot of influence of the pharmaceutical industry on information that physicians have, and sometimes that actually includes negative information on things like diet and exercise or alternative therapies. Even physicians who are not taking money from pharmaceutical companies may still be exposed to information just because almost every source of information is actually influenced. So, you know, certainly talk to your physician. That's really, that's important, but also seek out your own sources of information and make sure that they're actually evidence-based. Everyone has free access to Medline, National Library of Medicine's Medline, and there's other good sources of information too. We have unbiased information. We have sources of unbiased information on the Farmed Out website as well.
Let me jump in and just say, if anybody's having trouble finding the chat button, which you might, I noticed on my menu bar, it's hard to see. If you hover your mouse near the bottom, the choices will light up, and you have to go to the one that says more and has 3 dots because the chat button may not be there. Click on more, and then you'll see the chat button. And otherwise, it's not going to be there. With regard to that question, I have to say, I've been very sorry to see the complete absence and continuing absence of both nutrition teaching in medical school and interest in nutrition for people who are treating diabetes, even obesity. There's great enthusiasm for a new drug and relatively little for nutrition. And that's also true for statins and lipids. 90% of people don't have high cholesterol because they've got a lipitor deficiency. They've got plenty of cheeseburgers in their diet, and that's driving their cholesterol up. And I'm going to say something that's going to sound a little bit unpopular and is not in keeping with the medical society's viewpoint, I'm quite sure. But that's, I believe, that doctors who are treating patients with diet-related conditions, including type 2 diabetes, hypertension, obesity, and lipid disorders, should have CME that requires a CME requirement for nutrition. Or if you're going to see a person with diabetes, you ought to understand the role of diet. And the role of diet is not what sugar will do to your blood sugar. It has to do with much more complex things that have been learned over the past 20 years. Doctors rail against these requirements. I understand why, because frankly, there are requirements that are kind of loathsome and hard to tolerate. But until doctors learn nutrition on their own, I really think that the government ought to step in and ask them to learn about it. Okay, so yes, you should ask your doctor. There are some people who should absolutely, well, absolutely be particularly concerned about the effects of HRT, but frankly, I think every woman should be concerned about the risks of HRT. And I have become much more conservative about it than before. I would make one exception, and that's locally applied hormones. A woman's got some vaginal dryness and you're using a local compound that has minimal systemic absorption. Who cares? That's probably something that it's not the same as taking an oral or a patch. But apart from that, I'd be very concerned about HRT.
And I would say that often vaginal moisturizers actually work really well. You have very good systemic absorption of hormones through the vaginal area. So even though certainly it's not as high a dose as taking it orally, and I'm not against taking either vaginal hormones or even oral hormones if someone really needs them. You do absorb them actually quite well through the vagina. We've got a lot of questions of I think that are more should be more directed at Dr. Barnard. Yes.
Sure. Let's see if we can get through these, and I'll try and group them if possible. The first one is more of well, it is a question. Can Dr. Barnard, can you repost the slide about cooking, how to cook the mature soybeans? Is a request from the audience. While you do that,
while we talk?
Let's do that. Yeah, since we're running short on time, if that's all right. Another question: have you come across women who are? Oops, I lost my thing. Pardon me. Have you come across women who are having premenopausal PVCs that are related to their cycle and improvement with nutrition?
The only thing that I could say that might go to that is back in a couple quick things. In the 1990s, at Tufts University, researchers were looking at how they could reduce breast cancer risk through diet changes. And what they found is that increasing fiber intake and reducing fat intake, those two things independently modulate estrogen blood levels. So if you increase fiber, you're going to reduce estrogen levels. If you reduce fat, the same thing will occur. We put this to the test 20 years ago in women who had primary dysmenorrhea. I'm talking about basic menstrual cramps. And what we showed is that in about 8 weeks, 2 cycles, you could dramatically reduce the pain that women would feel. And it's not rocket science. You're just reducing the estrogenic stimulation of the endometrium so it doesn't thicken up so much, so it doesn't release so much prostaglandins at the end of the month. Okay, so that's all that we really know. But you can then take this to extrapolate to anything else that's related to either high estrogen levels or shifts, rapid estrogen shifts, because the diet changes reduce the overall level and reduce the variability.
We have some soy questions. Advice on isolated soy in, oops. Go ahead.
If you get them organic, they're not going to be GMO by law, and they're all okay. Most people would say the more it looks like a soybean, the better it is. So an actual soybean, and maybe next up is tempeh and edamame. Once you turn it into bacon, you've really changed the soybean a lot. It's still better than the thing it's replacing, pork bacon, but it's not quite the same as a more whole food. And the quantity of isoflavones is substantially less than you'll see in the whole mature soybeans.
I'd also just add, since there was the question about supplements, is that you can buy genistein capsules, and I don't think either of us think that's a good thing to do. You know, at some point when you've isolated a plant estrogen and put it into a high dosage pill, you're taking a drug. So you can't really overdose on soybeans.
So we've had a couple of questions about posting specific slides. We will make the slides available, Dr. Barnard, especially after the session, to those of you who have registered. So you will be receiving the cooking advice slides post-session. I'm going to have to go through and pick a couple of these questions out. Given the risk and having served as an expert witness in this field, so I think this is a directed question, is estrogen oral therapy ever appropriate?
Yes, absolutely. There are women who have very troublesome hot flashes for whom other interventions don't work, and hormones are effective for hot flashes. So that's certainly an individual that's certainly an individual choice. And for women who make that choice, I would just say try going off every 6 months or so. You don't necessarily have to take them for life. And if you stop suddenly, you may have rebound hot flashes. So, what I tell women who are on hormones and want to go off them is try just going off them. Some people have no trouble at all. But if you have hot flashes, when you go off them, go back on and try tapering off. And sometimes that will help. Some women still need to take them for years, and it can really help troublesome hot flashes. So not against their use in some cases, but wouldn't be the first thing I'd try.
Let me also recommend, if a woman has 90 days to wait, that was the duration of our study. And just, you might try a completely plant-based diet, greatly minimizing oils. I know that sounds funny because we're all in love with extra virgin olive oil or whatever, but when people greatly minimize it, it seems to modulate our guess is that that's part of the effectiveness comes from the change in the gut microbiome. And add the soybeans and just see if you don't have an effect. The reason that I suggest that is, in my impression in our study is that 8 or 9 out of 10 women report this to be a substantial effect and often a really life-changing experience where they feel like I've got power that I didn't have before and I'm not at the pharmacy counter. So you might give it a try and see what happens.
All right, I think we have time for one more question. Let me see if I can grab one that is fairly universal. There's some specific questions about different situations, about different sections. Let's try this. Any comments on fermented soy versus unfermented soy products? There was some conversation about them not binding to the same receptors or not in the same way.
I'd say there's a lot of debate about whether aglycones in fermented tofu products or fermented soy products are more easily absorbed. They may be more bioavailable, but there's also some conflicting evidence on that. So, maybe eat what you like.
All right, so we are up against 7 o'clock. What I would be happy to do, and if the presenters are okay with this, we can talk about it offline, is take some questions post-event and share them with the presenters. And if you all have an opportunity to maybe respond, we can figure out how to do that offline if that's possible. But I want to be respectful of everyone's time. So I want to say thank you to our presenters. I think we can all agree it was a very great, wonderful conversation, very informative. I'd like to thank Dr. Casaraneni, who is, unfortunately, I think had to leave a couple of minutes early, but I thank her for her work with women in medicine and the work that she and the group are doing. And thank everyone for being here tonight. Stay tuned for more and have a great evening, everyone. Take care.